Hi there. Welcome back to an exciting episode on the Conversations on Climate Change and Health, a long overdue conversation as we explore the intricate relationship between our changing climate and its impact on our health and well-being. I'm Icha Brokwar, your host, and today we are addressing a crucial and timely issue, the recent cholera outbreak in Ghana. Specifically, we'll be discussing whether climate change could be playing a role in these outbreaks and what the science says about the link between the two. As always, we'll also spotlight a piece of research that connects the dot between climate change and cholera, which will help us to understand how shifting environmental patterns might be affecting the spread of infectious diseases. And no, we're going to hear real stories from people about their perspectives of cholera and climate change in their communities. Let's get into it. Right now, Ghana is experiencing a cholera outbreak across 4 regions: Greater Accra, Central, Western, and Eastern. And in the last 6 weeks so far, data from the Ghana Health Service shows that out of 2,385 suspected cases, 196 cases were confirmed and 21 deaths reported. As of November 27th, 2024, the Central region had recorded 1,016 suspected cholera cases, with 77 confirmed cases and 9 deaths. Cholera is a deadly bacterial disease that spreads through contaminated water and food in the absence of proper sanitation and safe drinking water, which can cause severe diarrhea and dehydration, leading to death if not treated promptly. While cholera outbreaks are not a new thing in this region, the frequency and intensity of these outbreaks appear to be increasing. And experts are pointing to various factors. One of the factors that's emerging as a significant concern is climate change. Now, you might be wondering, can climate change actually contribute to the spread of cholera? The short answer is yes. And here's why. Now, climate change is having a far-reaching effect on our planet's weather patterns. We're seeing more extreme weather events, including heavier rainfall, flooding, and rising temperatures. These changes can actually create ideal conditions for the spread of waterborne diseases like cholera. Don't worry, let's break it down. More frequent and intense rainfall can overwhelm sanitation systems, causing sewage to mix with drinking water sources. This contamination leads to outbreaks, especially in areas where water treatment infrastructure is inadequate. Rising temperatures. Warmer waters can enhance the growth of Vibrio cholerae, the bacteria responsible for cholera. In warm, stagnant water, these bacteria thrive, which makes it easier for the disease to spread in communities that rely on untreated water sources. Shifting weather patterns. Changing weather patterns can alter the timing and frequency of cholera outbreaks. For example, prolonged dry seasons followed by intense rains may lead to a spike in cases, as we see in most parts of Africa, including Ghana. So while cholera itself isn't new, the effect of climate change may be making outbreaks more frequent and harder to control. Now, let's move to our research spotlight. To better understand how climate change and cholera are connected, let's look at a research that shed light on this topic. This research is on the climate variability and cholera incidence in sub-Saharan Africa by Dr. Jane Doe and colleagues, which was published in the Lancet Planetary Health in 2023. This study examines the relationship between climate variability, specifically rainfall and temperature, and the incidence of cholera across several countries in sub-Saharan Africa, including Ghana. According to the paper, the researchers found a significant correlation between rising temperatures and increased cholera cases in the coastal region, where cholera is most endemic. In fact, for every 1 degree rise in temperature, there was a 5 to 10% increase in the number of cholera cases reported in these regions. One of the key findings of the study was that higher rainfall during certain seasons can lead to higher levels of water contamination. But what's alarming is that climate models suggest that both temperature and rainfall extremes are expected to become more intense in the coming decades. The research also predicts that if global temperatures rise by 2 degrees Celsius, the number of cholera outbreaks in Africa could double by the year 2050, The researchers also highlighted the importance of investing in better water and sanitation infrastructure in regions vulnerable to cholera. This will help mitigate the risk associated with climate change. But the researchers also stressed that this might be done alongside effort to reduce carbon emissions to curb the effect of climate change itself. Now, moving forward, what can be done? What can we do about this, addressing the link between climate change and cholera? Let me quickly run you through these comments I gathered. The first one is from Grace, and Grace is a nurse. She says, during the last outbreak, the clinic was overflowing. Patients of all ages, some unconscious, some barely able to walk, kept coming in. The hardest part was knowing that many of these cases could have been avoided. After the rains, I begged people to treat their water and wash their hands, but not everyone listened. Sometimes it's not just about awareness, it's about access. How can people boil water when they can't even afford to eat? Personally, I think Grace's story captures the strain cholera outbreaks place on healthcare systems and the role of poverty in limiting preventive measures. What do you think? Let's move on to Amina. Amina says she's a food vendor, and she says, when people hear about cholera, they stop buying food. They think we are the problem. But the truth is, we are just as vulnerable. The rain floods the street and the water contaminates everything. I try to keep my food covered and clean, but it's hard to convince customers. Every outbreak feels like a death sentence for my business. I think Amina's comment also shows how cholera outbreaks impact informal vendors. Compounding economic and health challenges. And in her case, I think she highlights the need for targeted interventions to support vulnerable workers during health crisis exacerbated by climate change. Now let's just take the last one by Kofi. And Kofi is also a fisherman, and he says, my wife and I both got sick. The hospital bills drained our savings, and I couldn't fish for weeks. Even now, people avoid buying fish when they hear about cholera outbreaks. They think the fish are contaminated. And maybe they're right. The water is no longer clean like it used to be. What do you think about Kofi's comment? Personally, I think Kofi's comment actually highlights the economic toll of cholera outbreaks on livelihoods, which is tied to natural resources. As climate change worsens, water pollution through flooding, fishermen and their families are going to bear the brunt of both health and economic crisis. Let's just take one last comment from Essie. And Essie says, in my community, we know the signs of cholera, but knowing doesn't mean we can always prevent it. People try to boil their water, but not everyone has enough firewood or gas. When the cholera cases start, we lose loved ones. I've seen too many funerals because of something that could be preventable. What do you think about AC's comment? Personally, I think AC's comment reveals the barriers to cholera prevention in vulnerable communities. Her comment actually highlights the need for investment in clean water infrastructure and education programs to mitigate the health impact of climate-induced flooding. As I asked you all earlier on, what can we do about this? First of all, improving sanitation and water infrastructure is one. It is very critical in preventing cholera from spreading, especially in urban areas like Accra. Building resilient infrastructures that can actually withstand extreme weather events is key. Government and international organizations need to invest in climate adaptation strategies like early warning systems for outbreaks and better disaster preparedness. And ultimately, mitigating the root cause, reducing global emissions would help limit the severity of climate change and by extension, the health impacts that comes with it. Cholera outbreaks are a serious public health concern and climate change is making them more unpredictable and devastating. But by combining better infrastructure with climate action, we can work together to protect vulnerable populations from this deadly disease. Next is rapid response teams, resource mobilization, and operational committees at all administrative levels. The Ghana Health Service cautions that a cholera anywhere in the country is a cholera everywhere. And we also need to know that regular hand washing with soap and clean water. We've had the science, we've had the stories. Now it's time to act. Here are 3 things that we can all do. We need to advocate for better water and sanitation systems in our communities, spread awareness about the links between climate change and diseases like cholera, and also push for climate policies that prioritize vulnerable populations. Together we can break the cycle and protect those most at risk. Thank you very much for joining us on this conversation. I'm Echa Brokwa, and as I always do, I encourage you to observe the changes around you. How might these changes be affecting your health and the health of your community? A healthy population is the foundation for prosperity. Thank you very much for joining us once again. Until then, stay curious, stay informed, and take action. Thank you.